Hello and welcome. Welcome to KIAM's lectures. Today we have got a class, USMLE orientation class, especially for international students of Eastern Medical University. We have an exciting discussion forthcoming, and let us go and check what is there in immunology discussion. Well,
We are KIAMS, Indian Institute of Advanced Medical Sciences based in India and in Kyrgyzstan, Bishkek. So today we are going to take an orientation program of USMLE, where Dr. Khaleelullah Khan sir will be.
I'm Dr. Khaleelullah Khan. I have done my MD Internal Medicine from India, one of the top institutes in South India. And I had been teaching to students, Indian students and also international students, for various PG entrance exams for their medical specialities and super specialities since 2012. So in this a decade-long journey, I had been gathering a lot of experience, not only in terms of how to prepare for the exam, but also what are the trends that are these examiners following to introduce new type of questionnaire, so that students get updated. And every year I see a lot of changes in various exams. So in this session, I'll try to give you some slight orientation. I know that this half an hour might not be enough for entire orientation, but I would like to open up some certain doors for you so that you analyze things in a different manner, right? As you can see the data, if you talk about the statistics, United States attracts top doctors from entire world. They call us international medical graduates, IMGs. If you see the statistics of ECFMG, the board which is controlling entry and exit of these doctors from other countries, non-US doctors, more than 47% of doctors come from India and Pakistan. Every year, if you talk about last year, 2023, I mean this year, the match occurs in March. So in 2023, around 7,500 students gained their MD seat in United States. All right, these 7,500 students are IMGs, and 47% to 50% of them were from India and Pakistan. All right, what does that mean? That US healthcare also needs a lot of doctors. Unfortunately, their MBBS curriculum is very long. Their MBBS curriculum is different. So they are attracting all the non-US people to work for them so that they improve their own healthcare services. And why do you think that United States is so famous in healthcare? There is only one reason. The reason is they are into research. They are into a lot of research. What you read now in your textbooks, maybe 5 years back, they have already done it. They have already practiced it 5 years back. This is what happens in a lot of top universities in United States. Okay. So if you want to prepare for such exams, what should be your mentality and how should you start and how should you approach the subject? This is what we'll discuss in this class. I'll not bore you with saying that do this and don't do this, something like that. Let us talk about a small topic, very interesting topic. Within the topic, I'll tell you how to move about and gain also. Apart from basics of immunology, we'll be discussing certain, real lifetime based stories or scenarios or patient based clinical cases so that we get the maximum concept of the subject, right? So in immunology, as you all know, I'll tell you a simple basic term. Many of us have been suffering from certain diseases, and you might have heard our parents, grandparents telling you that your immunity is very low. Why don't you eat something? Why don't you have dry fruits? Your immunity is very low. Your immunity is not at all good. So what do they mean by that, and how is it important for a doctor? Sometimes some patient comes and asks you, sir, sometimes a patient comes and asks you, sir, please give me something which will improve my immunity. आप मुझे ऐसी दवा दे दें कि मेरी immunity strong हो जाए. ठीक है? So how do you decide that this person is having low? Wonderful drug in rheumatoid arthritis, you might be knowing. In case of ankylosing spondylitis, in case of inflammatory bowel disease causing reactive arthritis. There are various other drugs which I can talk, but because of lack of time, I'm not going into much details, but I just want to open up your minds and tell you that this is how you understand the basics, and this is how you integrate the basics and go and understand the diseases. Instead of going back, you are always doing the reverse. You talk about the disease, then you talk about the basics. That is wrong. Okay? That's the reason why USMLE step 1 is all about basic sciences. Step 2 is about clinical sciences. Got right side of the heart, the tricuspid valve. Left side of the heart, we have got a bicuspid mitral valve. And say suppose this is the right atrium, left atrium, right ventricle, left ventricle. So initially what happens is, this is the venous return to the heart. This is what happens here. Once the blood is reaching to the right atrium, there is right atrial filling. Most of the right atrial filling is passive because the right atrial muscle is not thick enough to undergo contraction and produce a negative pressure so that the entire venous return comes back. Why does the venous return comes back into the right atrium? Thanks to your lungs and the thoracic cavity. Your thoracic cavity, expansion of your thoracic cavity is causing negative intrathoracic pressure, which is transmitted into the right atrium as a negative atrial pressure, and it sucks in the blood in the right atrium. Now right atrium is full, left atrium is full. Once the right atrium and left atrium are full, what happens is it opens up the tricuspid valve and the mitral valve. Filling of has got different categories. First rapid filling phase, then rapid filling phase, then last rapid filling phase. Like that, 1/3, 2/3, and 3/3. We have divided this entire diastole into equal halves. Imagine a stiff vessel. We have a stiff vessel, and in that you pour water. Suddenly, what will happen? It produces some sound. Is it not? So left ventricle is acting like a stiff vessel, and in that some amount of blood is reaching, and you're calling it as a third heart sound, right? More and more sounds are occurring at the end of the cardiac cycle, because end of the cardiac cycle is lot of dramatic. I told you it is because of active contraction of the left ventricle and right ventricle, that is the filling of the aorta and pulmonary trunk occurring. And the diastole is very dramatic because we have got S3 and S4. Out of the S3 and S4, S3 can be physiological. What are the conditions in which you find physiological S3? In children, in athletes, very good, because of high flow, high volume in pregnancy. What is the normal plasma volume? Non-pregnant, I'm talking about general human being, adult. What is the normal plasma volume? Close to 5 liters. 4.5 to 5 liters is the plasma volume. Alright. In pregnancy, do you know what is the plasma volume at 32nd to 36 weeks of gestation? It's almost double. 8.5 to 9.5 liters. So because of high volume, in anemia, somebody said anemia, you're right. In anemia also what happens? The plasma volume increases. In beriberi also what happens? The plasma volume increases. Alright. Whereas in fever, thyrotoxicosis also sometimes S3 is heard, which are pathological S3. What are the causes of S4? In case of ischemic heart disease, in case of mitral regurgitation,
पहली बात तो बहुत बहुत शुक्रगुजार है इमरान नजीर साहब, जिनकी वजह से आज हम आपके सामने एक बहुत ही अच्छा सा स्पीच डिलीवर की है, एक क्लास डिलीवर की है। मोटिवेशन प्रोग्राम इंशाल्लाह आने वाले टाइम में हम और भी क्लासेस लेंगे यहाँ पे बिश्केक में, आपके यूनिवर्सिटी में भी ले सकते हैं, दूसरी यूनिवर्सिटी में भी ले सकते हैं, एंड वी विल डिलीवर as much as possible the best highly qualified specialists from India in Kyrgyzstan, and inshallah hope to see you soon, inshallah.
All right, thank you so much.
Camps.com से मैं आजिफ बोल रहा हूँ, मार्केटिंग मैनेजर। आज अभी हमने IUK में एक USMLE ओरिएंटेशन प्रोग्राम सेशन लिया है, जिसके अंदर में सारे स्टूडेंट्स रहे हैं, तो उनसे उनका फीडबैक लेते हैं, कैसा लगा उनको हमारी क्लास आज की।
Thank you so much for asking feedback, और it was a very nice session, and the professor की जो approach थी for solving towards the question that you the critical questions, तो उनके लिए कहा था the basics must be strong, and overall the teaching style was very student friendly, and it was nice attending the session.
जी, आपका नाम?
मेरा नाम ज़ीशा मलिक है।
आप IMU में कौन से कोर्स में पढ़ते हैं?
मैं IUK में 10th
sorry,
सेमेस्टर में जी।
अभी हम लोग ने USMLE का प्रोग्राम ओरिएंटेशन प्रोग्राम ने डिलीवर किया था। कैसे लगे आपको हमारा शॉर्ट सेशन क्लास?
मुझे बहुत अच्छा लगा, बहुत इन्फॉर्मेटिव था और पढ़ाने का मेथड बहुत अच्छा था। सारी चीज़ों को उन्होंने बहुत अच्छे तरीके से डिलीवर किया। इट वाज रियली वेरी गुड।
तो camsnext.com के बारे में आप कहेंगे कि हम ऐसे लेक्चर्स दोबारा कंडक्ट करें?
डेफिनेटली, बिकॉज स्टूडेंट्स की बहुत ज़्यादा हेल्पफुल है और वी रियली रिकमेंड एंड लाइक we should, like, every student should visit your page and like visit your videos and learn from them. Aruj Ashir.
आप IUK में कौन से कोर्स में पढ़ते हैं?
मैं IUK लास्ट सेमेस्टर में, 10th सेमेस्टर में जी।
अभी हम लोग ने आपकी क्लास यूनिवर्सिटी में ये USMLE ओरिएंटेशन प्रोग्राम किया था। इसके ऊपर में आपका क्या फीडबैक है इसको लेकर के, क्या कहेंगे आप camsnext.com का?
आपका लेक्चर बहुत प्रोडक्टिव था, हमें बहुत चीज़ें सीखने को मिली हैं। तो हम ये रिकमेंड करेंगे कि आप हमसे बाद आने वाले सेमेस्टर्स को भी ऐसे ही लेक्चर्स दें जो स्टूडेंट्स के लिए हेल्पफुल हो और उनके फ्यूचर के लिए हेल्पफुल हो। सो हम थैंक्स करेंगे कि आपकी वजह से हम कुछ भी सीखेंगे अगर तो। एंड थैंक यू सो मच।
थैंक यू सो मच, बहुत बहुत शुक्रिया आपका। थैंक यू वेरी मच एंड वी आर होपिंग टू डिलीवर मोर एंड मोर लेक्चर्स इन योर यूनिवर्सिटी। थैंक यू वेरी मच। क्या कहेंगे आप इसके बारे में, हमारे लेक्चर के बारे में?
सर ने जो पढ़ाया वो ऐसे समझ आया जिस तरह साफ पानी की तरह हमारे जहनों में घुल गया, और एक लेक्चर में हमें सर से ऐसे मोहब्बत हो गई जैसे एक महबूब के साथ होती है। सर को सुन के बहुत अच्छा लगा। थैंक यू सो मच सर।
हमारी कंपनी के ताल्लुक से क्या कहेंगे camsnext.com के बारे में, जो इतनी मेहनत करती है, आपके सामने स्पेशलिस्ट लेकर आते हैं एक से एक लेक्चरर्स इंडिया से?
ये फखर
काम करते रहे,
इसी तरह काम करते रहे। ये फखर की बात है कि आप हमें भी आपको देखने का मौका मिला, और जो देखने वाले हैं, सुनने वाले हैं, वो ज़रूर सर के साथ जुड़े। सर के पेज को, इंस्टाग्राम को फॉलो करें, सर को FB पे फॉलो करें। सर थैंक यू सो मच सर।
Thank you. Jazakallah. I am Azif Mohammad Arif, marketing manager of camsnext.com from India, Indian Medical Coaching Center, where we are into FMG, NEET PG, NEET UG, and we are very much thankful to Dr. Imran Nazir Saab and Dr. Khurram Nazir Saab for having us today, a wonderful session in the university, and hope we are looking forward to see and deliver more lectures in this university. Thank you very much.